Okay, so let's talk a little bit about anxiety. Anxiety is very common and it's normal. Anxiety is a normal process. Normally, we get a little anxious when we fear something, we're nervous about something, but for the most part, it should dissipate after a while. But when anxiety becomes so problematic that it interferes with your regular ability to do everyday things, like if you're so anxious that you can't drive on the freeway, or if you're so anxious that you can't even leave your doorstep, that's when it becomes a problem. Or if you can't interact with people, that's when anxiety does indeed become a problem. Okay. All right. So let's talk about those anti-anxiety or anxiolytics, we can call them. And what they do is they produce a very calming effect. Okay. They work to relieve anxiety and tension. We also use them for alcohol withdrawal symptoms. And alcohol withdrawal symptoms, patients tend to be jittery and jumpy and anxious. So we give them Ativan and what we call a CWA protocol, CIWA, and we give them Ativan every 2 hours to kind of keep them calm while they are withdrawing from alcohol. We can also give them preoperatively to calm a person down if they're going into surgery. We can also use them for diagnostic procedures. So if they have like an MRI or they're getting a CT and they're a little claustrophobic or concerned about going in those tubes, we can do that as well. And we can also use them to relieve muscle spasms. So side effects of those inoxalytics, which usually in the lambs or the PAMs, we can do they're going to suppress the respiratory CNS system. So just be mindful, they're probably going to be sleepy, they're kind of going to be drowsy. You may also want to monitor respiratory status because everything is slowed down. Monitor blood pressure because everything is slowed down. Heart rate, everything is slowed down. They do run a really high risk of addiction where you can't seem to calm down without having taken those medications. Interaction with anything that's going to further suppress the nervous system. So if they're taken along with opioids, you run the risk of an increased effect. Taken with alcohol, um, or any other CNS depressant, it can have the opposite effect when you're taking it along with grapefruit juice or those MAOIs. Unfortunately, it can make you a little bit more wired than calming you down. So for nursing implications, make sure when they're under your care, you're monitoring vital signs, in particular blood pressure, respiration, and heart rate. Make sure that they only get as much as the medication as they needed. So usually docs are not going to send them home on 30 of these medications unless they have really chronic levels of anxiety. Okay. Make sure that they are stored away from pets and children because these can be very damaging. So maybe locked up in a high cabinet or put somewhere, very, very safe so that children can't get into them or teenagers can't get into them. They are habit forming. So, like I said, the docs are usually going to try to prescribe the least amount possible. If they need them for extended periods of time, more than about 2 weeks, then we need to get to the root of the problem of what's causing the anxiety. And try not to take them with any nicotine or caffeine because those are vasoconstrictors and can increase everything. So it's going to work opposite the anxiety. Now you can take them in the morning necessarily if you're only taking the anoxylytic in the evening, but if you're taking it around the clock, then no caffeine or nicotine. Okay, so let's talk a little bit. We're moving on to psychosis. And in psychosis, the patients have a loss of reality. They just lose that concept of reality. So they don't understand that, they may not be seeing something, or they may be seeing something that you and I may not necessarily see, or they may be hearing things or having internal fixations where they're talking to themselves. Okay. Sometimes it can be quick setting or long setting. Usually quick setting is a cause of delirium. And usually that's going to be something like high temperature, maybe an interaction with the medication. Usually when it's quick and with its onset, you just treat the problem that caused the delirium. And for the most part, they should be okay. So if it's a temperature that's causing them to have like a febrile psychosis that's going on, you lower the temperature, and that's going to usually fix the delirium. And then it can be more chronic in nature where you see those in patients that have bipolar or schizophrenia. So symptoms of psychosis are going to include hallucinations. They can be auditory, visual, or tactile, where they're hearing things, seeing things, or feeling things. They can start having delusions where people are maybe after them. They may have delusions that they're more important than they actually are. They may think that they're, the president of the United States, or Queen Elizabeth, where they're just having that delusion, or that they are a celebrity. They may have some disordered thinking where, they're just kind of talking off the top of their head. Sometimes they're agitated. They can be homicidal, have homicidal ideations, even some suicidal ideations. They can be just, lack of motivation, don't want to get out of bed, don't really want to do anything. When you talk to them, they'll have that flat affect. They really just don't express whether they're happy or sad. It's just kind of a meh kind of, feeling. And sometimes they can stop taking interest in their personal hygiene. So they're not washing their hair, they're not combing and fixing their bodies, they're not washing their clothes and things like that. So we utilize for psychosis typical and atypical typical and atypical antipsychotics. The typical antipsychotics are the old ones. They are tried and true, but unfortunately, they have a lot of side effects. But these are the really, really old medications that we've utilized for years. Okay. And what they do is they block the action of dopamine in the brain. Studies have shown that high dopamine levels are what cause that excitability, that cause those delusions, or cause those people to see things or hear things that are not there. Okay. We can also use these in combination with, sedatives and tranquilizers and things to calm them down, especially if they're riled up and they're agitated and they're afraid because they're seeing things that are on the wall or hearing things that may not necessarily be there speaking or making sounds to them. Okay. So side effects include drowsiness and nausea. They can cause some dry mouth and some constipation. They can also cause pseudo Parkinsonism. So it would look just like Parkinson's. If you remember in the beginning, we talked a little bit about Parkinson's, where they'll have that rigid movement, those cogwort kind of movements, or they'll have that stiff and shuffly gait when they walk. It can cause that. They can also have the tardive dyskinesia, where they have those they have those uh, faces where they're kind of disrupted kind of faces. They may do the lip smacking or the pill rolling. They may have the coriform movements where they're twitchy. Okay. So here are the interactions. You can read those at your leisure. And for antipsychotics, please do not have them stop abruptly. They must be weaned off. So if the doc is going to switch them over maybe to a atypical, which are the newer drugs, they're going to have to wean the patient off while starting the new atypical antipsychotic. And we'll do those in a bit. Also, because they can cause a little drowsiness, no alcohol and no sedatives unless it's a bedtime. And you want to give them a lot of water and gum because it can cause dry mouth. All right, now here are atypicals. These are the newer ones, okay? And they also block dopamine, and they also block certain levels of serotonin. We will usually use these more so in schizophrenia as well as schizoaffective, okay? Now, even though the side effects do cause EPS symptoms, which are those things like tardive dyskinesia, the cogwort movements, the shuffling, the pill rolling, they are less likely, but it can happen. So, we do want you to definitely let your patients know that, but they are less likely. They have less side effects. They can cause insomnia and they can cause drowsiness. They've shown both. They can also cause orthostatic hypotension, constipation, and weight gain. So definitely let your patients know. And if they are already an existing diabetic, they want to make sure that they are monitoring their blood sugars exceptionally close because they can cause hyperglycemia. Okay. Now, just to let you know, like for when we talked about extrapyramidal symptoms, make sure that you understand that they can cause dystonia, akathisia, as well as bradykinesia, which I showed you those videos of those. So dyskinesia are those muscle spasms and those muscle contractions. Once again, dystonia, Once again, dystonia are those muscle and muscle spasms and contractions. Akathisia is more like motor restlessness, where they'll kind of tap their legs. If you've ever been nervous, you kind of shake your leg or tap your pen. So it'll be like those restless motor restlessness. And then we have bradykinesia, which are just slow movements, where they'll do that shuffly, slow movement. So just make sure you understand those extra pyramidal symptoms. Okay. Alrighty, so any medication that decreases dopamine, you want to be exceptionally careful in these medications because they'll have too low levels of dopamine. Alcohol as well, no alcohol, because they can cause a little drowsiness. You don't want to have your patients operating heavy machinery or driving, and also avoid any sudden temperature changes in those patients. So now let's move on to antidepressants and mood stabilizers. And normally we're going to give SSRIs, tricyclics, MAOIs, which we discussed a little bit further up, I think in Parkinson we discussed, and then SNRIs, as well as, we talked already about the atypical antidepressants. So let's talk about the SNRIs. Let's talk a little bit about the SNRIs, and they are serotonin norepinephrine reuptake inhibitors. And what they do is they potentiate the increase of serotonin and the increase of norepinephrine to bind to those receptors. So remember, we talked a little bit about when it goes across that synapse and it binds to a receptor, we want to increase serotonin levels and increase norepinephrine because serotonin is shown to be low in patients who are depressed, right? So we want to increase those levels of serotonin. And now the SSRIs are only going to focus on serotonin, but the newer meds, the SNRIs, also include the increase of reuptake of norepinephrine. Okay. So side effects of the SNRIs are going to be dry mouth. You may have some loss of appetite. You may have some sexual dysfunction. They can also cause some bleeding. So you may see nose bleeds, you may see GI bleeds, and also some liver damage because it increases the patient's predisposition for bleeding. All right, anything for drug interactions, anything that's going to affect serotonin levels or norepinephrines. Also, you don't want to give this with St. John's wort, which is just an over-the-counter herbal that patients can tend to take for depression. So if they are taking that, trying to look for, herbal alternatives, no St. John's wort with this one. For nursing implications and teaching, also discuss sex issues because it can decrease the libido, and of course that can be a problem if the person's in a relationship. So that can be of concern for a patient. Also, you want to discuss diet plan, especially because it increases the risks for bleeding. So foods that contain vitamin K may be of concern. And also, SNRIs can increase the risks of developing suicidal ideations, even they're supposed to work on that. But if the patient starts telling you, I feel like I want to harm myself, and they're taking the meds and it's not getting any better, we may have to switch to another class of medication. Okay. Now we have the tricyclics. And they also are believed to reuptake norepinephrine and or serotonin as well, okay? So we will use these for mild depression. Usually it's gonna be it could be endogenous depression or exogenous depression, and endogenous depression is more so like a serotonin imbalance. Patient really doesn't have anything necessarily depressing going on, but they still feel depressed. And then exogenous is gonna be because of causes, right? So if the patient loses a family member, well, naturally that's gonna cause some levels of depression in those patients. Side effects of the tricyclics are going to be orthostatic hypotension. They can put your patient at an increased risk for cardiac dysfunction. They can send your patients into heart failure or seizures. The interactions for tricyclics, very important, are sedatives. So if you're giving them with sedatives, be very careful. Also, the over-the-counter herbal supplement valerian root can cause increased sleepiness. Let me say that again. The over-the-counter herbal remedy valerian root can cause increased sleepiness. So no taking valerian root with the tricyclics. All right. So for tricyclics, you want to position very slowly because they can cause orthostatic hypotension. You want to take them near bedtime because they can cause you a little bit of the sleepiness. If it causes dry mouth, lots of water, lots of gum. and they should wear a medic alert bracelet that says that they are on a tricycle. Okay. Now we have the SSRIs, and the SSRIs are going to inhibit the reuptake, I'm sorry, they're going to act to inhibit the reuptake of serotonin, okay? So these will use for minor depressive disorders. So for patients that are, just kind of diagnosed with the major depressive disorder, we're going to inhibit those levels of serotonin, okay? So side effects are going to include sexual side effects. They may have loss of libido. They may have some suicidal ideations. They may develop flu-like symptoms, which in that case, you want to definitely make sure you're monitoring their temperature as well as their WBCs to make sure they're not going leukopenic on you. You want to look for issues with bleeding, so make sure you're monitoring those platelet levels, even liver function, to make sure they are not at an increased risk for bleeding. Also, you may want to monitor for hyponatremia. Look at those sodium levels, and it can cause weight loss and or weight gain. So here are some drug interactions there. You can read at your leisure. And as far as nursing, you want to make sure that you're monitoring and talking about suicidal ideations. So if they are feeling like they need to hurt them or they want to hurt themselves or others, make sure that they get checked into a hospital or seen by a doctor as soon as humanly possible. And also inform them of issues with sexual issues like loss of libido, that could possibly be a problem so that they can talk to their spouse or partner about that. And also if there's any serious weight loss or weight gain or anorexia, not feeling like they need to eat, then definitely they need to contact you so that you can ultimately notify the physician. Okay. All right, now we have our MAOIs. We talked a little bit about these ahead of time, so I'm not going to go back over them too much, but I would like to just revisit some of those side effects for you for the MAOI as well as some teaching. They can cause liver damage, so definitely make sure you're monitoring those liver enzymes. They can cause a variety of blood disorders, so you want to monitor your CBCs, look at your white blood cell count, look at your hematocrit, look at your hemoglobin, look at your platelets. And they also can increase the thoughts of suicide. So if they're verbalizing that they want to harm themselves or even others, definitely get them seen by a doctor as soon as humanly possible. As discussed before, the MAOIs have a lot of drug interactions, so you pretty much can't take them with anything, with any of the other psych meds, as well as foods that contain tyramine, like your aged food, your smoked food, sauerkraut, cheese, avocado, things like that. Okay. Because they interact with so many medications, make sure you get an accurate list of home medications so that you make sure they're not on anything that could interact with it. Also, I would dare to question diet. Find out what it is that they're eating. So, if they're eating, if they're drinking wine or beer or things like that, or sauerkraut or things like that, MAOI should not be on the bill because they cause hypotension, orthostatic hypotension. They need to change position slowly. They also need to be careful operating heavy machinery. And of course, no foods that contain tyramine. So that's why you're going to get a good dietary listing. And then we have mood stabilizers. Now, what happens in bipolar? Bipolar, there's a baseline where they're just, they're okay, they're functioning. And then we go above the baseline where they're manic, they're excited, they're spending all of their money, they're just big balling, they're doing all sorts of things. And then when you drop below that threshold, then they're depressed, they don't want to, get up and do anything. So what mood stabilizers do is that it helps to, when they're in the manic phase, bring them back down to the baseline. And when they're in the depressed phase, bring them up to the baseline, okay? So we're not quite sure, for example, lithium. Lithium is one of the most common mood stabilizers that we utilize, and it's exceptionally effective. We're not quite sure how it works, but it's believed that it helps to increase the reuptake of serotonin and norepinephrine. And we use it for bipolar. It stabilizes the patients out. So like I said, we help them when they're in that manic phase, and then it's also utilized to help them when they're in that depressive phase. So it keeps to kind of stabilize them out. Side effects can be mild weight gain as well as increased thirst. They can have increased urine output and maybe some dry skin, even hypothyroidism and renal failure. And it can cause diabetes insipidus, which if you're listening to this before you listen to the endo lecture, I go over diabetes insipidus for you. So interactions are going to be those diuretics, especially diuretics that are going to have you to lose your sodium and your potassium levels. Other antidepressants, you want to be very, very careful, even though docs do give them with atypical antipsychotics and regular antidepressants, but you just have to be very, very careful. And of course, with salted foods for those patients. Okay. And then lastly, for your teaching, make sure no alcohol. If that increase in thirst occurs, we want to definitely start monitoring their antidiuretic hormone levels because we don't want diabetes insipidus to be an issue. Monitor lithium levels very closely. We normally will monitor lithium levels, and lithium levels have a very narrow therapeutic range. Normal is 1 to 1.5 milliequivalents per milliliter. So it's very, very important to monitor lithium levels. Neurologic recording. I'm going to go ahead and post them all for you. Have a great day, and I wish you guys a great weekend. Bye bye.